Getting creative, injury prevention, and COVID-19. My name is Kevin Schmidt, and I'm the CEO of Workwell Prevention and Care, and I'll be moderating today's panel discussion. The goal of today's discussion is to show you how creativity can help you effectively address some of the challenges that you may not have thought about that COVID is laid at your doorstep. Today's agenda is going to cover a number of topics. We're going to talk about these crazy times. Obviously, we all know the many things that are happening today, but how do you adjust to managing injury prevention in these times? We're going to focus on getting creative with things like limitations that you may be facing, either ones by your employer or limitations that may come from outside sources. We're going to address the challenges created by an essential workplace as they present special challenges to all of us. We're going to talk a bit about how to be creative with employees at home, either working from home or those that have been furloughed. We're going to follow up with some creative thinking around employees who are returning back to work after COVID-19, and to talk a little bit about the role of the on-site PT in helping you to manage through COVID in creative ways that you might not have thought about before today. And we'll end with something that I always like is the 5 things that we're going to do or that you can do today. We have a distinguished panel today, and I'll go ahead and introduce them all. We have Corey Blickenstaff. Corey owns and operates Forward Motion Physical Therapy, which provides on-site physical therapy clinics. He serves as the current communications chair of the Occupational Health Special Interest Group of the American Physical Therapy Association and co-hosts, along with Sandy Hilton, the popular Pain Science and Sensibility podcast. We also have Eva Kunzik. Eva has worked in various positions as a physical therapist, manager, and director for 27 years and currently serves as the on-site services manager for Workwell. Eva is an OSHA certified provider and specializes in industrial rehab with experience in on-site workplace injury prevention, ergonomic analysis, job function analysis, job coaching in a wide variety of industries, including paper, plastics, glass, and pipe. Finally, we have Mark Yeager. Mark founded Highland Park Physical Therapy in Atlanta in 2001. His firm provides on-site injury prevention services, job analysis, post-offer employment testing, and office ergonomic analysis to a wide variety of industrial clients. Mark has over 20 years experience in providing on-site PT services. We believe that this panel will be able to highlight, again, some of the creativity we all need in managing through these challenging times. Well, what webinar would be complete without at least a 30-second commercial? So here I go. Workwell has been in business for over 20 years, and our mission is really to make it easy to help the modern workforce, keep the modern workforce healthy. We serve large national employers in multiple industries who have geographically dispersed workforces through a national network of specially trained providers. We offer post-injury employment testing, on-site prevention and treatment, post-injury testing, and job description development and validation. We are also the leading provider of training and education to equip physical therapists to effectively deliver services at employers' worksite. Much of what you will hear today from our panel was developed through our experiences in working on-site with employers over the last decade. I don't think it's news. I know it's not news that we're in crazy times. These are really unprecedented for most all of us. For the first time in history, there are 5 generations in the workplace with distinct needs and preferences to how they're addressed and communicated to. We have an economic downturn, which has been caused by a national crisis, which in parallel, we have a level of social unrest that most of us haven't seen in this country for decades. And to add to all of that, this is happening all at once. So it certainly makes anything that we would normally do challenging. I think the question is, what can you do to get ahead of things and be proactive with so much that's right in front of you that demands your immediate attention? In addition, you're faced with a constantly changing situation, at least most of you are. You have workers working from home in large numbers that have never been seen before, at least in most people's work experience. You may have the need to do alternating shifts to accommodate social distancing while still maintaining production levels. You may be in an essential workplace where you're having to hire fast to meet critical demands. And lastly, there's complexities with returning people to work after an illness that we fully don't understand yet. These shifting sands really make creativity essential. And we hope that today's panel discussion will show you some different approaches for some of these different situations that you may not have faced before. I'd like to start off the discussion talking about limitations, and I'd like to invite Corey to kick it off. I guess the question, Corey, I'd like to start off with, and as it's a panel discussion, we'll invite anybody to jump in here from our panel. What limitations might you face, Corey, when confronting COVID that have required you or your employer clients to be creative to navigate through them?
Sure. First of all, good morning, and thanks for having me on. So I'm in Washington State, so my experiences have to do with what's going on here, and each state, of course, is kind of, had similar experiences, but have approached it in some somewhat different ways. The way it has gone on in my sites, and I'm in multiple sites, multiple worksite locations, was a little different from place to place, and some of those depended on what the site did, and some of those depended on what the state was doing at the time, as well as our own policy decisions that we were making. And initially, I mean, since I'm in Washington State, I mean, we had the first known case, we had the first known outbreak, so things were really kind of ramping up pretty early on here. And so first there was just the social distancing aspect. I mean, initially there was just that push to, hey, we probably need to be staying 6 feet apart from each other, and you need to be looking at how you're arranging your workplaces and things like that, which, initially was not, didn't create a huge change in what we were doing, except for that the world is not really built to be 6 feet apart. So we had to, look at it, for example, at how people were going to be moving through different workplaces. We rearranged our treatment area so we could know where we were standing far enough away from people. And, one thing for us, one of my work sites especially, took on a mask policy really early on. It's a Taiwanese company. It's a little bit more in that culture. And so even before all the mandates came out, there were, everybody had to wear a mask that was on the site. So we had to kind of rearrange some things for that. But then as it became, more and more serious, more guidelines came through, there was a push for more remote work and limiting access to sites. People, the work sites were really starting to look at, okay, who do we want to be having on site? Who do we not? And so for us, that meant they needed to go through the process to see, are we somebody that they felt like was critical to what they were doing enough that they wanted to continue to have us come on site. And both of our Washington locations determined that yes, they did want us to continue coming on site. And we had to think about what are the things that we do on a regular basis that are kind of vital to the value that we bring to the workplaces. And some of those are getting out into the workplace, and we call it doing rounds. We walk through the floors, we talk to people, we check in with folks. Of course, seeing people who are having problems. We're regularly doing ergonomic assessments and being involved in ergonomic processes. We're helping them develop and maintain and validate their functional job descriptions and doing the analysis that encompasses that. So we started to have, okay, how are we going to be able to continue to do these things with some of the limitations that are coming down? So as that progressed, one of our locations determined they wanted us to continue to be on site all the time, that our policies could reflect the changes that we needed to make. The other one decided that they asked us the question of, could you do your work remotely? And that began the conversation of what could be done with telehealth. So that site decided that they wanted us to pivot into a remote telehealth driven process, which that required quite a bit of creativity on our part. I mean, telehealth has been out there for a little bit, but it was not really widespread prior to COVID. Now it's been implemented pretty widely, so it's been kind of a quick learning curve. But we had to figure out how are we going to continue to do the things that we do. So, which we were able to do, and took some education on our part to kind of help our work sites and the people that we work with understand, how can we do what we do as physical therapists without being, face to face with somebody and putting hands on people and things like that. So after that came down and things continued to progress, then the state started to mandate some things. So in Washington at that point, we got our stay-at-home order. So then the question was, are we as physical therapists essential staff or not? And it was determined, the state of Washington determined that physical therapy was an essential workforce. And then our individual work sites we had to figure out if the work sites that we were at were essential, in which in my case, all of them were. So we continue to be essential. Our work sites continue to be essential. But along with that, there was the whole PPE shortage, right? I mean, or the pending PPE shortages. So the state was asking healthcare workers, they shut down in Washington, they shut down elective procedures. Again, they didn't shut down physical therapy necessarily at that point, but they were really asking all healthcare providers to limit any kind of non-urgent care. So again, we had to really look at how we were arranging in the site that we were still face-to-face, how we were arranging things, which again, we had to further arrange our physical space to make sure that we can maintain our distance. But then after the stay-at-home order, we actually got another letter came down from the state specifically to physical therapists, where they asked any non-urgent cases, and they spelled out what that meant, to not be done in face-to-face. So what was interesting, it was in one of our locations where we were still going out to the location. This place has some pretty strict electronic restrictions. You can't take your cell phone into the site. They really limit what services your computer has and things like that. So the telehealth option was not the same there. So we had to get really creative to figure out how can we continue to come out to the site and continue to do all these things that we do. And in this location, we set up a remote location that was within the site. So we had two different spaces within the site. So we were on the site, but we were not in the same room as the people that we were seeing, which was really interesting. But it worked out really well. Considering it not being able to be face to face, we were still able to continue to interact with people. So that was kind of the progression of some of the limitations that we had and how we dealt with them. I think the real big pivot for us of how to deal with that was the use of technology, the use of telehealth. We were able to set up, calling rounds, things like that. I think it was really vital that we already had that relationship going into that process to be able to start that. It would have been a little bit tough, but anyway, I feel like I'm starting to ramble. That was really some of the things that we had to deal with.
Well, great. Thanks, Corey. I guess one question I have for you is, how did you see being on site affect your ability to pivot to providing these services remotely? Did it make a difference that you had been on site for a while in terms of your effectiveness, when you had to move over and all of a sudden start seeing people remotely?
Yeah, I think that was really vital. So knowing knowing kind of how the pivot to telehealth went in general across healthcare and specifically across healthcare clinics, everybody tried to do it because it was what was left available when these limitations presented themselves. And I know, a lot of clinics, even though they moved to this, they had a real hard time with still connecting with people. I mean, some people just weren't interested in being seen that way. Other people had challenges with using the technology. But for us, because the population that we were serving, we already knew them, they already knew us, we already had some kind of established ways of how we interacted with each other. It was really just as simple as setting it up and making a real clear process of how people could get onto the programs and talk with us. And I think if we didn't have that relationship established, that would have been much more difficult. For example, in one of the locations, it was as simple as we set up a station. We scheduled them for a time to come in and see us just like we normally would. They walked in, there was clear instructions sitting on the desk at the computer of what to do, of how to get in touch with us. And it was as simple as that. And if they didn't, if for some reason there was an issue, all we had to do was get on the phone and talk them through it, versus, had we not had some idea of what was available within the site and how they might be able to arrange things, it would have been a much more challenging proposition to kind of set that up in a successful way, I think. So yeah, I think it played a huge role in helping us do that successfully. For example, in our situation, we were able to take our pre-COVID, post-COVID, how busy, how many interactions we had with people, and compare them, and we were able to stay very busy. Our interaction numbers stayed relatively level, which out in the community, in an outpatient physical therapy clinic, there was huge drop-offs. There was a big change in how busy they were able to stay. I think you might be on mute, Kevin.
Sorry. Let's talk a minute about an essential workplace. And I want to start with Mark on this one. What about essential workplaces where you're really working to keep employees safe, informed, and productive? What role can and should creativity play in these essential workplaces?
Well, certainly in the site that I am on primarily, it was it's part of the food supply chain distribution center. So as here in Georgia, when we started the shelter in place in mid-March, everybody was still working. So it stayed active, it stayed functioning. So there really wasn't a change in terms of the work activities, but as the new novel virus became more apparent and we learned more and more about it, it was certainly a dynamic process. So being an essential function, the workers still needed to stay engaged with their job. And then as my role as an on-site physical therapist, one of the essential functions I perform is an educator. So trying to transition from my typical on-site work safety educating and safe work practices, really transitioning more towards employee safety in terms of this virus. So we kind of unknowingly started back in November preparing for COVID. And when I say unknowingly, what we saw early in November was that, in addition to injuries, work-related injuries, colds and flus have an impact on the business. So we started doing heavy education in cold and flu prevention, encouraging flu vaccination. So we were starting that in November, December, and then as we started to hear about the novel virus, we just transitioned that education towards the coronavirus, towards COVID-19. And I looked back, and I think we first started doing on-site education back in early February. So, so the creativity really has come from that transition of focus in terms of safety. And what we really wanted to try to do is make sure that we are reducing or preventing absenteeism because it was an essential workplace. So we focused our training in the initial symptoms to watch out for: the coughing, the fever, the shortness of breath. But as time passed and we learned more and more about the virus and how it was affecting people, we included the symptoms to watch out for, like the loss of smell and taste, sore throat, the gastrointestinal issues that were showing, that were part of the symptoms that people were being afflicted with. Our information that we were presenting wasn't just a nice to know kind of information like that we might present in terms of reducing cholesterol or reducing blood pressure. This was really a need to know for the workers so that they could stay healthy and safe. So in addition to the information that we had talked about previously with cold and flu prevention, the washing of hands, the avoiding of touching eyes and things like that, as we learned more about the virus, educating the workers on wearing face coverings and social distancing and health monitoring so that they could maintain their health, but also know when they needed to call in and call in sick and not show up for work. As everybody kind of throughout the state kind of got their systems in place, the public health department, I was frequently on site with them trying to know what was the current information in terms of where could people go get testing sites. So as soon as that information became available, we started posting of that. So my focus as on-site, like I started off mentioning, really transitioned from being focused on safe lifting technique and ergonomic recommendations to really promoting the health and safety of the workers in terms of preventing contracting the virus. This was important because the staff that are on site here, the safety manager, the HR staff, they already have a busy schedule with the daily activities that they had to do. So I really saw my role is helping them, being a resource for them on this topic of COVID-19, presenting to them what was the current information that we were learning about how to best protect their workers. And then they would bring information to me that I might do some research and then show them maybe best practices in terms of housekeeping, sanitizing surfaces, things like that. So I really tried to be kind of the eyes and ears out on the floor, talking with associates that were out on the floor, making sure, seeing how they were doing. And that kind of transitioned to hearing stories about spouses, partners, family members that had been affected, maybe furloughed or their businesses were shut down. So that led us to develop a community resource newsletter. Every month I write a wellness newsletter that we present various health information, but we created this newsletter that was a community resource where associates could go for food, where they could go for food pantries, for charities that were providing meals, food banks, things like that that could help them reduce the stress that they were likely feeling in this current environment that we were in. This information, it was presented in various ways. So this is kind of where the creativity comes into play as well, because there are different learners, different people that take information in different ways. So we did handouts, we did newsletters, wall and door postings in common high traffic areas. We distributed information electronically to the managers and the supervisors. In the driver's lounge and the break room, there's a TV monitor, so posting information up there so it was readily available and we could stay up to date on any current information that was coming our way. In terms of just basic education, what I try to do, generally speaking, but certainly related to COVID-19, understanding like how people learn. There's your social learners that learn from groups versus your solitary learners that would more readily learn from the newsletter that I'm handing out to them. Those that are more visual, that like more of a video that I can put up on that TV monitor in the break room, versus those that I can give them a detailed handout and they'll absorb that information. So really trying to understand how the workers might learn and take this essential information that they'll need. We do have associates that are not, English isn't their first language, so translating this information into Spanish was really critical too, because that information is necessary for all associates that are present. This information too, we wanted to make sure that it was appropriate in terms of the associate's health literacy, which is just the individual's ability to read and understand healthcare information, that they can make decisions and follow instructions. So putting it in a way that's not technical, which oftentimes, if any of you have gone to the CDC website or to your state public health, there's a lot of technical information there, and just making sure that the information that they're being presented with is something that can be easily applied to them, and then promote those helpful practices. I think generally speaking, for those that are here, kind of a brief takeaway in terms of education is just really looking at the workers that you have, and how can, whether it's your retail workers, your transportation, your drivers, service repair that might be going into people's homes, or your business traveler that's in airports, hotels, and all that, trying to translate this information and making it applicable to those workers and those associates and those work activities.
Great, thanks, Mark. It really, it sounds to me like that kind of extra set of hands that an employer is looking for, and really talking about the differences that having these 5 generations in the workforce have really sort of caused. So.
Yeah, definitely. And it was, the interactions, being out on the floor is something that allows me to interact with the workers and to understand where their concerns are. They can ask me questions like, do I really need to wear this mask? And I can reinforce those safe practices so that they can stay safe and, carry on that with, hopefully, with their family members and with their friends.
Well, thanks. For this next question, I'd really like to open it up, and maybe we can start with Eva. You're trying to always maintain a balance between the employee's physical abilities and the demands of the job, even when employees are off work. How can you go about trying to, if they're off, say at furloughed, or the site is simply shut down, are there some things that you can do to try to keep the employees at the same physical ability they were while they were working, so when they do return to the job, they'll be better equipped to start? So let's go ahead and start with Eva on this one.
Okay, well, hello, this is Eva, and thanks for having me today. Good morning, everyone. You could provide workers with suggestions for a basic fitness program, considering the demands of the job. In addition to helping with their fitness, it could be a way to keep employees engaged.
Do you see any particular challenges? I mean, when you're talking about fitness, what I think about is people say, hey, go home, take a walk, do push-ups, do sit-ups, do those kinds of things. But it seems to me that what we've seen is that knowing a person's job specifically and tailoring the kinds of things to specific jobs makes a big difference. I guess I'll ask the panel, if you're designing some sort of a program to keep people in shape, what things might you consider to make that connection more real and hopefully to get them to really participate? Anyone want to jump in on this one?
Yeah, I can jump in. This is Corey. Yeah, I mean, for one, I think knowing the demands, knowing what people are doing out there is vital. It helps in multiple domains. If somebody's off, in a typical situation, if somebody's off and is hurt or something's going on, it kind of helps you understand where they need to be able to be back and be safely working. But in this case, if somebody's got a certain amount of walking that's part of their normal day-to-day job, well, then you can encourage them to do that stuff at home. And so you can really tailor it towards specifically towards how are you going to be ready to do the things you need to do when you get back. The other thing I'll say is that one thing that we really focused on was, because this was all happening at the same time as we are being asked to stay away from each other. There's a real worry about some of the social isolation stuff that's going on. So we really try to cater some of this stuff towards ways to encourage people to use exercise and use staying in shape as a means to still have some social interactions. We put out a lot of things about, okay, you might not be able to go for a walk with your coworker or your friend, but that doesn't mean you can't talk to them on the phone while you're doing what you're doing, or you can do some things on Zoom or all these different applications that are out there to still be interacting with people. And I think that was a big piece. That was something I really worried about, was some of the negative impacts health-wise of people being isolated. So we kind of tried to mesh some of that, how to stay active, be ready for your job in some specific ways while also still interacting with your family and your coworkers and your friends.
Did you find any differences in between the generations? I mean, as you were offering up suggestions, were there any differences if you had, say, a younger workforce, predominantly Generation Y or Z, versus a workforce that was maybe more boomers?
This is Mark. In where I'm at, there's actually an older age range, and there's definitely a younger age range that is doing more of the warehouse selecting type of work activities. And so I found that the older generational workers are definitely more engaged, or asking me, what can I do to stay in shape? And I get more of that interaction, and I get the sense from the younger group that they're working hard, doing their job already. That's their physical activity, and that they're, for the most part, active otherwise. So that's kind of been my experience.
Okay. Let's just talk for a minute about what to do to help employees that have had COVID. I mean, and I'm going to ask Eva to jump in here. And the question really that I've been thinking about is, how do you deal with workers who are returning from COVID who may be deconditioned? They're potentially scared. They're looking for answers. The question is it okay? How am I feeling this way? If I have a cough, if this aches or this pain comes up, they're seeking some answers. What are some effective ways, Eva, that you might have found to deal with these returning workers?
Sure. So many of you out there may have had employees who were returning after having had COVID and may be experiencing some unique issues. But depending upon your state and national guidelines, there may be a period of time where the employee has had to take off of work. So they become deconditioned, as well as they may have had either a mild case or a more severe case of COVID with a possible hospitalization. They may have such symptoms as pulmonary or cardiac issues, muscle weaknesses due to immobility, or just decreased endurance overall. So that gives them, in a sense, a new normal. Some things you may want to consider utilizing for these new employees are fit for duty testing, which return to work testing can assess an employee's physical abilities with regards to their job duties, and it can identify any work restrictions. It can also help put a plan in place regarding that particular employee. For example, if one might need temporary job modifications or might need job rotation until they're able to perform at the previous standards. You could consider job coaching or worksite check-ins, which Corey mentioned, as well as Mark. These could be very helpful. This is when an on-site therapist walks around the plant with a prepared list to check in with employees whom they know they have had issues and are back to full duty. It helps to identify individual needs. You can touch base with them, ask them how they're feeling, both physically and mentally. Are they struggling? What do you see when you're looking at their job site? Could you perhaps suggest some modifications? And be proactive. Rounds like this will also help coordinate management with the healthcare team. It definitely can identify patterns of need on the production floor before it affects the workflow. So some tips you could give and think about would be rest is important and being pain-free is also important. Be patient with themselves. It will take some time. And focus on what you can control versus what you can't control.
It seems, Eva, that it may be fair to say that different generations might respond differently and integrate back into the workforce at different speeds. So doing some of the things that you've suggested, how you do those and when you do those may vary, again, depending on the makeup of your workforce. Because at the end of the day, you're trying to meet people where they're at always, but especially if they come back from COVID. Would you agree with that?
I would agree with that.
Great.
Yes. So it may take a little longer to get an older aging workforce back up and running, whereas a younger workforce may take less time. Definitely.
Okay. Well, let's talk a little bit about Eva, about how a PT can help. I mean, traditionally, I've been with WorkWell for 20 years, and physical therapists to this day are still thought of as just break fixers, right? Waiting in their clinics for a patient to walk in with a script from an MD to show up, and so they can start working on them. In what ways can a physical therapist be used creatively to help employers manage through COVID? And I'm speaking specifically of a PT. I think the last slide talked about some of the strategies, but from this perspective, what else can a PT do that employers might not have thought of to provide that extra set of hands?
Yeah. So when you have a management team that could possibly be overburdened, you have another team member there, your on-site PT, who can be another set of boots on the ground, just like Mark was referring to in his examples. They are there, they can interact and engage with employees, not only from a healthcare perspective, but also from a perspective that understands their job demands. The industrially trained PT has a unique perspective, one that combines the knowledge of musculoskeletal and cardiopulmonary issues with ergonomics and industrial job demands. So right now we're in uncharted territory with this COVID pandemic, and this puts a PT at a perfect vantage point for assisting with returning employees back to work. For example, with their knowledge of job demands and job descriptions, they can assist management and supervisors in modifying jobs for limitations like social distancing. A PT can assist with setting up stretching programs or progressive reconditioning for an employee who has been on furlough or had time off due to COVID. And a PT can perform OSHA first aid to individuals with complaints after coming back to work. For instance, employees may not be used to standing for long periods of time because they've been off for several weeks and might be suffering from foot and knee pain. Your PT can assist you with suggesting insole programs, stretches and micro breaks, ergonomic instructions for lifting, pushing, pulling. A PT's expertise can be a powerful asset to transitioning the workforce back to full operations.
I can see that, and I guess I would throw out a question to the panel here that, you know, often people catastrophize their discomfort, and that may lead to unnecessary anxiety or medical visits. Do you all see a role for the PT as being a medical professional and being able to help reduce this kind of catastrophic thinking among people and guide them to the right resources so they can get the help they need if they need it, or feel a bit relaxed, more relaxed about some of the symptoms post-COVID that they're feeling, as such as deconditioning? Do you see a difference generationally in how people might catastrophize how they feel returning from COVID?
This is Mark. Yeah, I think being on site and understanding all those work factors that Eva just mentioned does give us the ability to take the workers' complaints. If it's like, you know, a shortness of breath, is that a lingering issue from their COVID? Is it still part of their recovery? Are the joint or muscular discomforts that they're experiencing actual injury, or is it just their body getting used to returning back to those work activities? So we have a unique ability to be there present and offer that advice with the workers. And then looking at the older generation that might have comorbidities, other issues that are also complicating their physical health capacity, we're able to help differentiate that and help give them either some peace of mind that this isn't something that is a severe situation and just more an exacerbation of what they've been dealing with. So I think we can really help the employer as well as the workers navigate that new territory as they're returning back to work and they're dealing with recovery, or they're dealing with just, even for furloughed workers that haven't been working, those return to work aches and discomforts, that it's not an injury, it's just your body getting used to doing those activities again.
Thanks, Mark.
Yeah, and could I jump in on that real quick, Kevin?
Yeah, go ahead.
This is Corey. I was just going to say that, you know, when I think of catastrophizing, so, you know, catastrophizing is the specific process where, you know, you think the worst possible outcome is the most likely. So like if you've got, you know, if your heart is racing, you think you might be having a heart attack, things like that, is an extreme example. But I always feel like with any kind of catastrophic thinking, it's a lot of the unknowns that really drives that. And, you know, especially with COVID being such an unknown in general, like there's a real high potential that this catastrophizing is going to be an ongoing issue. I mean, we're kind of figuring, you know, they're figuring out what it looks like. You know, a lot of it we're still figuring it out as we go, as far as what the disease presents like. But, you know, like they were saying, like Eva and Mark were saying, our role as physical therapists is we can kind of help set out a roadmap. You know, these are the knowns. This is what we expect this is going to look like as you improve or as you get back to work. And really being on site helps with the communication factor with that. You know, like as you're coming back to work, you know, we're working with you and we're working with your supervisor to kind of know what's your first step. Okay, when you come back, what's the first thing you're going to be doing? Are you going to be expected to go back to full time, you know, right away, and you can't come back at all until you do that? Or is there going to be some kind of a transitional step along the way? And what do you need to do to get to that transitional step? Like that roadmap kind of helps fill in some of the unknowns, and that really, you know, the research out shows that that's a lot of what can be done to reduce that catastrophic thinking, is to really kind of fill in the gaps of what's unknown and what's known.
Mhm.
And certainly, you know, what was said earlier is regular day-to-day safety operations don't stop. So I think about this in the education and the ways that a PT can help with their experience. Just many hands make lighter work. And I think that getting out of the thinking that it's strictly break fix, waiting for a script is a valuable way to think about this. Well, let's wrap this up or begin to wrap this up and get to your questions. You know, I always like at the end when you have some things you can do today, and things we've identified certainly throughout this panel discussion is identify your work demands. I mean, you really need to understand your work because job descriptions, accurate, up-to-date job descriptions are foundational for everything. They help in return to work, transitional work design, if you have to make job modifications to accommodate social distancing, and you're making sure you're hiring a workforce that has the balanced abilities to meet the workplace demands. So having these job descriptions available really is going to help everybody as they plan for the various phases of this particular crisis. I think, you know, you're trying to create programs that we talked about to meet people where they're at. You know, are they at home? Are they returning? Are they new hires? You know, trying to make sure that the programs you create are tailored and that you're communicating in creative ways. We've talked about the importance of generations, right? Different generations appreciate how you do things in different ways. It requires creativity to successfully navigate this. You know, what you provide each generation, how you provide it, and when you provide it, all require creativity to effectively connect with each generation. And I think that that's one of the themes throughout all this. One size does not fit all. And having this kind of experience and being able to think creatively will help, again, meet employees where they're at and help make this navigation through this crisis a bit easier. So I'm going to go around and ask our panelists for any final thoughts for today.
I'll jump in. This is Mark, and I know that there's probably many of you here that may not have that job description that is ready to go like Kevin just described, but you need to get your workforce either back in shape and ready to work. And like Corey is mentioning earlier, just as far as keeping employees in shape, you know, gamifying worker fitness. If any of your insurance plans have an app that you can communicate within your workforce to do like squat challenges or walking programs, things like that, to energize, get them excited, but yet encourage them to get back in shape. That would be a good opportunity to do that.
Right.
Yeah, this is Corey. I would, and real similar to what Mark is saying, I think understanding the job demands is one of the best things you can be doing preparation wise for all these things we've talked about. It helps you be ready for taking next steps, and you know, not just with COVID, but in general with any kind of return to work, or I mean, it's a starting point for a lot of the ergonomic processes that we do. It's just something you can really prepare for a lot of things based off of, and then, you know, just really looking for more ways you can be communicating. I mean, I think that's a lot of the value that we bring is, you know, we're talking to people on a regular basis. Even something as simple as, do you have the cleaning products that you need? You know, do you need me to talk to medical for you to get, you know, more cleaning products, or how's the spacing going? Putting out a lot of information to, you know, as things become more known and as this is an ever-changing process, communicating how you're going to deal with those things really can help handle the unknowns and really help people deal with it. So yeah, I think just enhanced communication is really key.
Great. Eva, any final thought here?
Yeah, I would say addressing OSHA first aid for complaints of pain is very important. It keeps you proactive, and it keeps everybody ahead of things that could spiral into a greater problem in the future. So pay attention to those employees that have those complaints and see what you can do to address them.
Great. Well, I'd like to thank the panel here. The fifth step is really a white paper, practical ideas and tips to be creative during this crisis. Many of the things that we've discussed today are in this white paper and available through the website. And with that, I'd like to open it up for questions. I know some questions have been coming in here, and I'd like to start, again, open this up to the panel. But one of the questions, comments that have come in is it's been hard to get the attention of employees who are not at work or are at the office. Any suggestions on how you can get the attention of employees who aren't right in front of you? Any things that techniques that you've found to keep their attention?
This is Mark. I think that that gamifying idea to where they, if you can get other workers on doing the same program, walking or some kind of targeted exercises that relate to the demands of the job, I think that might be a way to engage, because as we've all talked about, those that are not at the work site, they are isolated. They feel disconnected with their fellow workers, where work gives us a lot of social interaction. And that might be a way to do that in kind of engagement and that social motivation.
Okay.
I think having a varied approach is also important. I mean, some people are going to respond well to verbal interaction. Some people are going to respond well to the written word. Some people some people are very visual. So I think having multiple approaches to your communications or your information is really good. Also, I kind of think of it in terms like you would do a marketing program. You don't just put something out by drip approach. A lot of times when I'm calling people, I'm calling them on a regular basis, and it might just be like, hey, I'm just checking in to see how you're doing, and just kind of letting them know that you're thinking about them and that you care about them, and that you want to give them a chance to communicate any problems that they might be having. But really, kind of like you said initially, Kevin, meeting them where they're at. Different people are going to be at different places at different times, so just really having a consistent, frequent, and varied approach, I think, really helps.
One thing that's come up in a few questions as I scan through them is we've mentioned the term rounds several times. Several of you have. Can somebody talk a little bit more about what we mean when we use the term rounds?
Yeah, I also call these ergo walks. It's when the physical therapist and whoever they want to take with them, or whoever decides that they want to participate. It could be the EHS manager, it could be somebody from human resources, supervisors, even employees. Walk through the plant, walk through important departments, areas where you might see trends in ergonomic issues, and touch base with everyone. You ask how they're doing, see what they're doing at their workstations, make notes. It's a way to identify not only your employees that are struggling, but also any ergonomic issues that may be present in the department at the time, process issues, and then you have a group of people there ready to respond and to help identify those needs.
Okay.
Yeah, and on addition to what Eva said, I see as an on-site provider, I see the workplace, I see the work and the workers very differently than the staff, the associates that are here, your safety department, your HR, all the workers. I see they have all their different essential work activities that they're doing to promote that business. And I see that all differently. I see the individual workers, I see how they're working, I see their work environment. So it's kind of a unique experience that that on-site physical therapist provides, is that we see the worker from a very different perspective than the people that work here every day. So I think that's kind of where that value add is.
Great. Well, thank you.
I saw one of the questions was about called rounds, and I think I had mentioned that earlier. What I meant by that was when we were no longer allowed to be out in the workplace face to face with people, the way we continued to do those rounds was we got real organized. We got lists of the shifts and the schedules and who was where and when, calling around to each control room. If there's somebody in particular I wanted to talk to, I'd call out to their area and ask for them. So really, again, when a limitation was imposed, what can we still do to still talk to them? And that was what we did. And it worked really well. It's, not as good as face to face, but when you can't do that, it was a good second best.
I think that's kind of a good segue into another question I'm seeing here. Employees may be private about having had COVID. How do you approach an employer check-in, considering they may, want to keep the fact that they've had it private?
Mm-hmm. Yeah, this is Eva. It's just a check-in to say, hey, how are you doing? How you feeling? You don't necessarily have to bring up any past medical history to anyone. Just you know as a provider that this person may have been affected, and approach it very generically.
Okay.
Yeah, and whenever we do our rounds too, there's always, regardless of COVID or any kind of medical issue, privacy is always a big concern for us as health providers. So, you can kind of, when you're out face to face with them, you can kind of pull them aside and give them the opportunity to share things with you in a private manner.
This issue, handling COVID, is obviously complicated enough. A question that's come up is, if you have multiple sites, it hasn't been easy to keep everybody coordinated. Any tips when you're trying to manage through COVID with multiple sites, what you might do to keep everybody on the same page and maybe disseminate best practices?
What we found here is that identifying a lead person at each location and communication. I mean, that's probably the best, most effective tool to use, is just communication, and talking about how barriers and facilitators for getting the message out. And there's nothing better than having that one-on-one interaction with the associates, what works well, what doesn't, and then sharing that with other team members.
Well, great. Well, I'd like to, I'm mindful of time here, and I appreciate all the panel's time in discussing these issues. I'd like to offer to our audience, if you have any follow-up questions, please feel free to reach out to us at Workwell, and we'll see what we can do about answering those questions. And I appreciate your patience in spending an hour with us today, and wish you all well and luck in the world as we go forward and face what comes next in this country. Thank you again for your time, and have a good rest of your day.